Hi, I'm Dr. Philip McMillan. Thank you for joining me as I go through this presentation about catastrophic contagion. I have just recently done a presentation on the mystery illness in children, and I thought that this point was quite significant in relation to what we could be seeing happening in the world. With that in mind, you have to realize that we are at a transition point where we have to reflect very carefully on the lessons that were learned from the COVID 19 pandemic. And so, as I go through this process, it will involve me looking at some information from the Johns Hopkins about catastrophic contagion. And then I'll be doing a video in short segments. The video is about 8 minutes long. And in between each segment, I'll just give some thoughts and then I'll summarize at the end as to what I think, in my opinion, is relevant. So let's get started with a few things. So we have here catastrophic contagion, and this is making reference here to a tabletop exercise. Okay, so this is not real. It's a tabletop exercise that was organized by Johns Hopkins in association with the WHO and the Bill and Melinda Gates Foundation. And this was in October 23rd, 2022 in Belgium. And they had a group of participants consisting of 10 current and former health ministers and senior health officials. Included were Senegal, Rwanda, Nigeria, Angola, Liberia, Singapore, India, and Germany, as well as Bill Gates, who was the co chair of the Bill and Melinda Gates Foundation. So, this is the process that they were going through in preparation for what they thought could be a possible catastrophic contagion. It's important to do a fact check on it because this was highlighted last year, and we have USA Today clarifying this point that the Bill Gates announced the next pandemic will occur. This was from a video in December 2022, and this was related to this. They were saying that this is just a tabletop exercise, it's not real. So, for those who are into conspiracies, this may surprise you, considering that there was also a tabletop exercise before the COVID 19 pandemic. But of course, that's just coincidental. And so it raises the question because we're seeing something similar to what could occur in terms of their catastrophic contagion situation in the context of China. And so this is why it's very, very important. Here we have that the point is that they simulated an exercise emergency health advisory board meetings, a fictional pandemic to set in the near future. So they were responding to an epidemic located in one part of the world that then spread rapidly, becoming a pandemic with a higher fatality rate than COVID 19, critically, disproportionately affecting children and young people. So, this is essentially why this is important. This is why it would have been different from what we had before. It would primarily be affecting children and young people. Very significant. And it's something that we have to be very concerned about because if that happened, that would really be a disaster for the world. How do you prepare for it? So I don't have an issue with a preparation exercise, but I'm very concerned about whether or not lessons were adequately learned from the COVID 19 pandemic. And this is what I'll be trying to see if I can take apart. So the participants in this study included here, this is Anita Cesario, and she is from the USA at Johns Hopkins. We have Awa Sek, and she is from Senegal, and she is also looking at she's a bacteriologist and virologist specialist. We have here Bill Gates, who is an international public health expert. No, oh, I think he funded this, so he has to be there. Let's just go on with that. Then we have Donald Kaberica, who is a former finance minister, and he was, as well, as we mentioned, from Rwanda. We have Joanna Hainfield. She is from Germany, from International Health Protection. That's her expertise. We have Vijay Raghavan, and he is Department of Atomic Energy and critically the National Center for Biological Sciences. We have Luis Gomez Sambo, and so he is has 45 years of experience working internationally. He's from Angola. We have Mike Ryan, and he is the director, executive director, WHO Health Emergencies Program. You have Mark Dybul, and he is from Georgetown University Medical Center, and he's therefore is the USA. He has worked with HIV. You have Mohammed Ali Pate, and he is here, and he is from Africa as well. And you have Paul Lin Lian Lim, who is representing the East from Singapore. Critically, I didn't see anyone from China, but this is representing the Asian side as well. And we have Tolbert Nezwa, and so he is as well the USA and Liberia. I think he was previously Deputy Health Minister of Liberia. Dr. Tom Frieden, he is the USA as well, and expertise in internal medicine, infectious disease, public health, epidemiology. And Tom Inglesby, and he's the director of Johns Hopkins Center for Health Security and Bloomberg School of Public Health. So this is quite a comprehensive group of people who are planning to discuss this tabletop exercise as to what it is that they thought should be done in the context of what we could be seeing now with regards to what's happening in China. So it's very important for us to be prepared to listen to what they're thinking about and reflect carefully on what we think should be put in place in order to try and protect the health and well-being of everyone. So let's just start with this video and we will see what they are saying. Just checking here. It seems as though you can't hear what is being played. Is that correct? No sound at the moment. I will see whether or not that can be fixed. But the essence so far is that they're going through this tabletop exercise just to try and see if they can clarify what is happening or what could be occurring with regards to the pandemic. Now, it's important to recognize that when they did this exercise, so I'll just summarize what they said. They predicted that this was effectively a pandemic that occurred somewhere in South America. And this was the start point, somewhere in South America. And it was an enterovirus. It was affecting primarily children. And they were anticipating in this situation, you could have up to 20 million children who died from the pandemic. It was spreading quickly. And their concern was, how does a global organization manage to deal with that in the context of how does this work? What can they do? And so this is the critical part of bringing these experts together. What, in a sense, they're asking about is how do these experts internationally come together to come up with a plan, a strategic plan that would then allow them to be able to implement a strategy across the world. Now, this is very important in the context of the WHO because the pandemic treaty that is coming into being by about May of 2024, I think it's going to be ratified by about the 1st of December, would then allow the WHO to implement this at a global level. Now, the concern with that is that I wonder if the lessons from COVID 19 have been learned. There was one section of it where they were talking about the problems that they were likely to face in the context of misinformation and disinformation on social media. I would think to myself that misinformation is only misinformation when the facts are not clear. And only one person, when they were talking about that, made it clear that it was important when they were putting across information to clarify what they know from what they don't know. And this is one of the failures that I can see that has come out of COVID 19 and the pandemic is many people who would be arguing that we must do something like this have not actually at any point clearly acknowledged what mistakes were made. They make it seem as though this was done perfectly. No, nothing is ever done perfectly, but it is absolutely critical to acknowledge whether or not mistakes were made. Because if you are unable to acknowledge mistakes, it would suggest that you are willing to sacrifice for the purpose of other entities, whether it's financial, whether it's political, because you are not able to lose face. That kind of approach in the context of what happens in a pandemic, I don't think at all could be considered to be appropriate. So I think that's a very important point with regards to that. So let's bring back a few points about the lessons that they had from this here. So I'll bring this up here. And so from the tabletop exercise, they highlighted that leaders must prepare now to make difficult, critically important decisions with limited information in the early days of the next pandemic in order to increase the chances that a dangerous outbreak can be contained at the source. This is an important point, and I think this is reflecting what it is that they saw with regards to the COVID 19 pandemic, where maybe if there had been better controls in place at the time, we could have controlled the spread of the virus from China. The truth be told, no matter how tightly you control it, and China demonstrates that even after 2 years of zero COVID, the virus was still going to spread. There was no easy way out of that. And so the only thing that you buy is time. And so one of the arguments could have been if you can control it initially, you can buy the time to bring in the necessary therapies that would probably improve the chances or reduce mortality. So that's about it. Seems like all these critical policy decisions have been resolved the WHO pandemic. I don't think so, but they have not. I agree. In the catastrophic contagion simulation, even a group of some of the wisest and most experienced international public health leaders who lived through COVID 19 wrestled with opposing views on whether or not countries should impose travel restrictions or close schools to try and contain a serious new epidemic. There's no doubt that it's challenging. This is not an easy situation that anyone would be able to try and handle. And leaders have a tough job with trying to make the decisions about this. But critically, I've always said, whatever decisions you've made, you have to be accountable for it. We have seen some of the arguments that are coming up, certainly in the UK, in terms of the lockdown principles. Have there been acknowledgement for any of the errors around that? Now, I'll be clear about something. I'm one of the people who I'm happy to say where I got something wrong. Now, I had thought that lockdown at the time was probably the best thing to do early in the pandemic. But by the time the second wave was coming, and we realized that clearly there was data that demonstrated that children at that time were at very low risk and young people, it should have been argued, or it could have been argued, that you develop herd immunity, natural immunity, by allowing the virus to spread and continue to isolate the vulnerable. This was before a vaccine was available. Now, this would still have come with deaths, but you would have reached to a real herd immunity across the globe much more quickly. And part of the mistake seems to be that people want to try and prevent all deaths. That is not necessarily possible in the context of a pandemic. It's about reducing mortality in the short and medium term. So they said here countries should establish a global network of professional public health leaders who can work together to improve pandemic preparedness response and strive for consensus on scientific issues in advance of the next major outbreak. I think that this is important, but I can't quite understand why they think a next major outbreak is likely to occur so quickly in the century in the 21st century. That's we technically had the 1918 flu pandemic, and then we did not have a pandemic like that for almost 100 years. Why would we think that within a few years we would have another pandemic that would be so devastating? Well, one of the reasons may be that people know that there are viruses being developed with gain of function capability that could cause something like that. So I'm very surprised that at no point in there they didn't address that very important point. Origin of COVID 19, where did it come from? How was it to be able to be so dangerous and effective across the world in terms of spreading disease? These are quite significant things that need to be addressed. And I'm really concerned when important questions about origins are not adequately addressed. There are many things that have come out which suggests that the virus could have been a lab origin, maybe accidentally leaked. Where is the work around that? And how could we make sure that something like that doesn't happen again? So, moving on to the bit that I think is quite important as well. So, countries should prioritize efforts to increase trust in government and public health, improve public health communication efforts, and increase the resiliency of populations to misleading information and reduce the spread of harmful misinformation. This is a big one. And this is one that there are no easy answers for. Because in order for you to do this, if you are going to censor and do scientific censorship, you are not allowed to be wrong. And this is a really important point that people don't seem to get. When you do censorship and you close down other opinions and other ways of looking at it, and you cannot challenge it with factual and evidence-based information, you're in a problem. And so you have to remember that the public had been told very early on in the pandemic 2 doses, this is over. 3 doses, this is over. 4 doses, five, six, seven. How can you have public trust when the answers as to why that was not what you said at the beginning have not even been acknowledged? This is the kind of thing that I think that is really, really critical and something that has to be addressed in order to handle problems with misinformation. Now, misinformation is real, and it's something that we all have to face. I face it all the time with challenges, and I challenge them back with science. I don't shut anybody down, I don't block them, and I always listen to what they have to say. That's proper academic thought, science, and approach to how we should be able to handle these things. Censorship is very important. That I think that with censorship, it means you have got to be right. You have no room or leeway to be wrong. And the final point is that the WHO member states should strengthen international systems for sharing and allocating scarce public health resources. Again, this is an important point. I don't know what makes us think we would do better in the next pandemic if it came along quickly. When we think about the fact, and I bring this point up because it's important for everybody to reflect on this. When people were talking about vaccinating their populations and trying to get large swathes of the population to buy in to being vaccinated, this was being done in first world countries outside of the high risk group. So, what that means is after they had completed vaccinating their high risk groups, instead of sharing the vaccines across the world so that high risk groups in every part of the world could have been protected from severe COVID 19, no. The leaders, the politicians, the financial sector saw this as an opportunity to get out of the pandemic first, because mistakenly they believed that if everyone was vaccinated, the transmission would stop. That's what I mean in the context of the mistakes that have been made. How can you have equity? Just imagine, as I said, imagine if this virus was as lethal as they thought it was at the beginning, and the vaccines were as effective as they thought they were going to be. Imagine what would have happened to Africa. Only 2% vaccinated almost a year into the pandemic. They would have been decimated without the health resources to back them up. They wouldn't have had the ventilators. Can you imagine the damage that would have been done across Africa? So, this is what I mean in terms of dealing with the issues. Those issues still have not been dealt with. Probably the only reason that Africa is being prioritized now with regards to vaccination, way beyond they've had natural herd immunity, is because other countries don't want it. That is not acceptable in the context of a very serious and severe global pandemic. So, these are some simple points that I wanted to highlight about this scenario. And as we come closer to what could be some kind of replication, because this disease, the mystery virus, well, the mystery situation in China with mycoplasma, does look as though it is primarily affecting children. That could be very, very serious and have serious implications for the whole world. Have we learned enough from the pandemic? Time will tell, but we certainly have to make sure that we do better at educating the public, being honest, being open, bringing in the correct experts. This is the final point I will make. If you have experts who have made mistakes, the worst thing you can do is continue to use them. Bring in fresh minds, fresh thinking, fresh solutions. Don't limit your options to all the eggs in one basket. Be open to creative solutions and understand that medicine is not the purveyor of the first world. And sometimes the best ideas in the world come from places with limited resources. I highlight Dr. Shankara Shetty as an example of that, with what he achieved in his community in South Africa with zero deaths cannot be replicated anywhere else in the world. If the world had followed his instructions, can you imagine how many lives would have been saved? Have a great evening.